These are the people in my speech.
122 left in the game, up 12, first round of the 2012 playoffs. Drives middle for a pull-up jumper and pop. The 2011 NBA MVP, Derrick Rose, diagnosed with a torn ACL. My purpose of this speech is to inform you on a surgery that many people face. I will be discussing what happens leading up to surgery, what happens during and the day of, and the recovery process after. Some of us know at least one person who's gone through this surgery, but do we really know what they went through? Not just physically, but also mentally. I had this surgery a year and a half ago, and I wish that I had somebody next to me who had gone through this surgery who could tell me that everything that I was feeling was completely normal. Your ACL is a ligament that sits right behind your kneecap, and it helps with stability and rotational and pivotal movements. Oftentimes, this ligament is torn on non-contact activities such as a forceful turn or deceleration. Like I mentioned earlier, most of us know somebody who has gone through this surgery. Hopefully, by listening to somebody who has personally experienced this, you can help somebody in the future if they have this injury. First, I will be discussing what happens leading up to surgery. Second, I will be discussing what happens the day of surgery and during. And third, I will be discussing the rehab process after. So now let me begin with my first topic, what happens leading up to surgery. So oftentimes when you tear your ACL, you hear a really loud pop in your head. Right after, your knee starts swelling and you have immediate pain. When this happens, you need to go to a sports medicine doctor who will then refer you to get an MRI. When you get an MRI and you get your results back, you will then be referred to an orthopedic surgeon who will go over the results with you. 3 things can happen here. Number 1, he can tell you have a sprained ACL, which requires rehab to fix. Number 2, you can have a partial tear in your ACL, which doesn't have to be fixed with surgery. And number 3, you can have a full tear, which requires surgery to fix. Angus Wallace, in his article, Surgery is Effective, stated, ACL reconstruction for athletes has been found to be the most effective. With a grade 2 or grade 3 injury, with a grade 2 or grade 3 ACL injury, surgery is the most recommended option because it is the fastest, safest, and easiest way for an athlete to get back to their sport. Now I will talk about my second point, what happens the day of surgery and during. The morning of surgery, you get to the hospital 2 to 3 hours before your scheduled surgery time. When you get there, you get checked in and you get taken up to pre-op. In pre-op, you're meted by nurses, taken back to your room, and given medicine that makes you numb and helps with nausea and pain. After this, an anesthesiologist will come in and he will give you a nerve block. A nerve block is a big shot in your leg that numbs your leg from the inside out. So it's different like when you go to the dentist and you can touch your mouth and you feel numb. It's different, it's from the inside. So when you wake up from surgery, you're in no pain and you don't feel anything. And this lasts for 24 hours. After the anesthesiologist works his magic, you will then be taken to the OR. When in the OR, you will be put under and the doctor will go ahead and fix your knee. When you wake up from surgery, you will be in no pain. You will be a little tired and a little nauseous, but then you will be moved from a bed to a wheelchair to a car, and your car to home. This leads me to my third point, the recovery process. The recovery process starts the day you get home. You work on quad sets, you work on range of motion activities, and these are the building blocks for the rest of your rehab. Following a week after surgery, you will then go to physical therapy where you will still work on strengthening your quad, and then you will go to walking, running, jumping, and then eventually you will get cleared. Recovery is not just physical, and that's something that a lot of people don't realize. Recovery is also mental. Lauren Mayer stated in her article, The General Well-Being, Physical Health, and Psychosocial Health of Young adult male subjects following knee surgery. She said, nonetheless, it is not uncommon for patients with knee impairments to have problems in the psychosocial health domain, meaning that recovery is not just physical, it is also mental. My goal of this speech was to inform you on a surgery that many people face, but not just the physical aspects of it, also the mental aspects. In my first point, I talked about what happens when you get hurt up through the process of when you have surgery. My second point, I talked about what happens the day of surgery when you get home. And my third point, I talked about the rehab process, the mental and physical aspects of it. As I previously stated, a lot of us will know someone or have known somebody that has gone through this surgery. Hopefully by listening to someone who has personally experienced it, you can help somebody in the future. Derrick Rose said in the middle of his rehab, You have one job, and that's to get better. And I think that's applicable to many parts of our life, because if we're always striving to get better, that's the best thing that we can do. Thank you for listening to my speech. That's all.